Nigeria crosses the 10,000 mark in COVID-19 infections. Islamic group says regional security outfit Amotekun is part of Yoruba plots to form Oduduwa Republic. In international news, many American cities in flames as riots spread over police killing of black men. And in sport, Tonga rugby team stranded in New Zealand.
This is ANN News.
I am Olajumoke Olatunji. Daily reports of increasing numbers of COVID-19 cases in Nigeria is beginning to sound like a broken record. But the more the needle grinds on the groove, the more it is becoming obvious the pandemic is hitting hard. Now the country has passed the 10,000 mark in the number of confirmed infections after the Nigeria Center for Disease Control reported 307 new cases on Sunday. New total now stands at 10,162. Perennial runaway leader in infections cases, Lagos, recorded 188 new cases, followed by the Federal Capital Territory with 44 cases. 3,007 patients are said to have been discharged, and nearly 300 have died. Chairman of the Presidential Task Force on COVID-19, Boss Mustafa, who is also Secretary to the Government of the Federation, says the fact that Nigeria is now experiencing community infections has dropped the responsibility on state governments and community and religious leaders for the next phase of the battle against COVID-19. Mustafa said at this stage that the nation is entering the next phase of the eased lockdown measure. The federal government will now only provide supervision and coordination. After U.S. President Donald Trump touted hydroxychloroquine as the wonder drug in the treatment of the new coronavirus, a study from Marseille, France, and a pronouncement by the World Health Organization says the drug is actually ineffective and could even be fatal for COVID-19 patients. Nigeria has decided to continue with clinical trials of the drug, and correspondent Kelechi Emekalam reported why the country is taking that route.
The World Health Organization recently called for caution in the use of hydroxychloroquine on COVID-19 patients. Nigeria says it will continue to examine the drug's potential after data shows it's been effective on patients, especially those with mild symptoms. This is coming as Nigeria and the world seek possible treatments and cures for the novel coronavirus.
Well, it has not been agreed that it's a treatment for COVID-19 infection. What we have had severally is that there have been some good results from patients who are COVID-19 positive and use chloroquine. However, for you to be able to scientifically prove that it actually works, there are some levels of clinical trials that you have to pass through.
But the drug isn't the only option Nigeria is open to. The Food and Drug Administration and Control says the country is exploring other homegrown remedies, but it's doing this with caution and adhering to necessary protocols.
We neglected herbal medicine research for years, for decades. We are secretive as a culture. My own parents or grandparents died with their knowledge, have a lot of good herbal plants, but we've neglected it. We have what it takes in this country. Not for COVID necessarily, but including COVID. We don't know yet whether something can work for COVID. It has to be tested. It has to be researched into. So that is what we are encouraging our researchers and practitioners to submit to us what they think may work.
I think it's a welcome development, except that Nigerians should not be gullible enough that think that the fact that we've started this, then it means that it will certainly work. Thousands and one investigation or tests or clinical trials are going on different formulation, which may also include herbal mixture.
About 4 research projects have so far been submitted for further analysis and testing. Nigeria has also procured Madagascar's herbal mixture for COVID-19, following claims that several patients recovered after being treated with the remedy. Authorities reveal that the plant used in Madagascar's remedy also grows in Nigeria. And like Madagascar, Nigeria wants to look within for its own solution.
The Central Bank of Nigeria is debunking the rumored release into circulation of 2,000 and 5,000 Naira banknotes. Pictures and videos of the purported new denominations of the banknotes have been making rounds on social media over the weekend. CBN announced on its official Twitter page the videos and pictures of the banknotes are, quote, false and fake. The Central Bank is asking the public to report to law enforcement agencies anyone found to have such banknotes in his possession. The Muslim rights concern, MURIC, an Islamic human rights organization, says there is a relationship between the Southwest Regional Security Outfit, Amotekun, and what it calls the Yoruba recent agitation for the establishment of Oduduwa Republic. The group says Muslims in the region will never be part of, quote, the proposed republic, end quote. It says the governors in the 6 states in the region should be aware that some elements are seizing on what it calls the euphoria of the moment to fulfill their selfish objectives. The Muslim rights concern says succeeding from the Nigerian Union cannot be in the interest of Yoruba people. This statement were contained in a press release by MURIC's director, Professor Ishaq Akitola, on Monday. Asina State Police Command is reporting that unknown gunmen have killed the chairman of the All Progressives Congress, APC, in Basari local government area of the state. News Agency of Nigeria quotes police spokesman SP Gambo Isa as saying Sani was killed when he resisted being kidnapped by the bandits. Isa said law enforcement is on the trail of the killers, hunting them into the forest with the goal of bringing them to justice. Coming up, African news. The continent's confirmed COVID-19 case total reaches more than 142,000. And later, international news. Many American cities in flames as riots spread over police killing of black men.
You are watching ANN.
Remember that Nyanya was telling her I want marry. She dey come my house today. I'm gonna tell her to marry me.
Remember what I taught you about playing music from the internet?
I'm gonna play romantic music for her. The phone remains small, make it done. Will you marry me? I have a surprise for you. Google, play me a romantic music. Everything is okay. Network is shaky. Google, play me a romantic music. Google, play me a romantic music.
Maybe I should go.
Don't let poor internet ruin special moments. Join the super fast and reliable 4G network and get double data.
Now in the watch.
Welcome back. This is ANN News. Johns Hopkins University in the United States has confirmed COVID-19 case total from 54 African countries as of Sunday has reached more than 142,000. Reported deaths in Africa are now 4,077 and recoveries 59,585. South Africa has the highest number of cases at nearly 28,000. The deaths numbering nearly 600. Other most affected countries include Egypt with 21,000 cases, Algeria and Nigeria now breaking the 10,000 case threshold, and Morocco at nearly 8,000. The Johns Hopkins figures are based on statistics from the World Health Organization and other international institutions, as well as national and regional public health departments. South Sudan has welcomed a new player into its cross-border mobile money transfer service. The new company has vowed to make it even easier for South Sudanese people who want to transfer money within the country or to Kenya and Uganda. They can now do all these transactions from the comfort of their mobile phones. And correspondent Patrick Hoyet has the details.
Sending money across borders is getting easier and easier. With just a few clicks on a mobile phone, people can transfer cash to friends and family hundreds of miles away. A service provider known as M-Gurush now allows customers to send or receive money within South Sudan, Uganda and Kenya via their mobile phones. South Sudan's government says the service is slowly replacing cash transactions in the country.
We have started with our neighbors, where we know that so many of our loved ones, and especially in this lockdown situation because of the coronavirus, South Sudan and M-Gurush especially is contributing its function as a financial solution provider to this country to have opened the international remittances.
In the World Bank's most recent published global remittance figures covering 2018, individuals in South Sudan received $1.3 billion in remittance. Many South Sudanese people have relatives in Uganda or Kenya, either as refugees or students who need financial support. Now, the mobile money service is making transfer of money to those people easier. M-Gurush has partnered with financial institutions in South Sudan like Equity Bank. The bank says the mobile money service is helping it reach all parts of the country.
I think the way to engage in all the transactions is by pushing it to what we call digital platforms. And I think M-Gurush come in timely simply because we want to ensure that while we are trying to convert the spread of COVID-19 pandemic, this is one of the measures.
The government says it is working with M-Gurush to ensure that payment of utility bills such as electricity is done through mobile money and avoid crowding in the banks, which could spread the coronavirus. The government says encouraging the use of services such as mobile money would help generate more revenue.
Through M-Gurush, as a Ministry of Finance, we are looking for a national income to our minister. So through taxation,
M-Gurush says it is working on improving its platform to enable users of its services to send and receive money from across the globe.
Before COVID-19 struck, South Africa had embarked on a massive infrastructure project that was geared towards reordering the nation's economic recovery. But the advent of coronavirus has reshaped the landscape. As Angela Coppola reports, the country is now looking for investors to push the plan to fruition.
The aim is to develop an infrastructure-led growth recovery plan that will stimulate economic activity and job creation. But the COVID-19 pandemic has changed the investment landscape, and that's occupying the minds of program organizers and advisors.
What we've seen as a consequence of COVID-19 has been a very parochial, inward-looking, introspective approach by most countries. And I personally am skeptical that we're going to see the same level of cross-border capital flowing as we have done historically in a more stable global economic and political environment.
The development of the renewable energy sector is a prime example of what can be achieved.
We should do nothing to undermine that track record. In fact, we should be taking it and we should be applying it to many other infrastructure projects, whether it's road, whether it's rail, whether it's ports, whether it's telecommunications, whether it's water.
But there are uncertainties around the regulatory environment which have been a hurdle to getting capital commitments.
We can't have uncertainties as to the sanctity of contract. We need to ensure that we've got absolutely reliable cast iron terms and conditions, as I've said, and appropriate levels of return which reflect the risk that is being borne by the various parties associated with the project. If we don't address what have been very significant constraints in terms of regulation, or we ensure that there are appropriate levels of return, terms and conditions that are available to investors, and by investors I include lenders, any providers of capital, then we're not going to mobilize the capital that's required. And some of those issues have been outstanding for a long time.
For South Africa to get those investors involved in those bankable projects, it's going to have to do things slightly differently.
It's not as though government is not aware of this. The issue is getting internal alignment, not only across government, but also in particular within state-owned organizations that are critical counterparties to such projects. And unless and until we do that, we're not going to be able to achieve our potential in terms of not only the projects, but the speed within which they are implemented.
When we return, international news. Many American cities in flames as riots spread over police killing of black men. And later, sport. Tonga rugby team stranded in New Zealand.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, African News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. Sunday was the 6th day of angry and violent mass protest across the United States after a Minneapolis police officer killed a black man, George Floyd, on Memorial Day. A protest that started peacefully has now exploded into an outbreak, with some demonstrators setting buildings and police cars on fire in Minneapolis and many other major cities across the country. A man was also shot dead in Louisville, Kentucky, when police and the National Guard opened fire on protesters. Riot police clashed with protesters in New York, Chicago, Philadelphia, and Los Angeles, firing tear gas and pepper bullets to try to disperse the crowds. Associated Press reports 4,100 persons were arrested across the country over the weekend. Many also died in the milieu. Police in Washington, D.C. fired tear gas at demonstrators who set fire to properties near the White House, including the historic St. John's Episcopal Church near the White House. It is called the Church of the President. Chiara, daughter of New York Mayor Bill de Blasio, was among the hundreds of protesters arrested. Curfews have been imposed in nearly 40 cities. The National Guard says 5,000 of its personnel had been activated in 15 states and Washington, D.C. In the face of mass demonstrations outside the executive mansion at the White House, Secret Service agents rushed President Donald Trump to a White House bunker on Friday night, where he spent almost an hour. The bunker was designed for use in emergencies like terrorist attacks. Friday's protests were triggered by the death of George Floyd, a black man who died after he was pinned at the neck by a white Minneapolis police officer. The demonstration sparked one of the highest alerts on the White House complex since the September 11 attacks in 2001. The UK government has further eased COVID-19 lockdown restrictions despite warnings from health authorities of a greater risk of a second wave of infections. Some schools reopened in England today, and people are now allowed to have limited contact with family and friends, but with extreme caution. Restrictions have also been eased for vulnerable elderly persons and those with some underlying health conditions who have been asked to remain indoors since March. Outside exercises will also be allowed from Monday among up to 5 different households. Outdoor activities including golf, tennis, bowling and finishing will resume in Scotland on Friday with social distancing in place. Britain's official coronavirus death toll stands at more than 38,000, the second highest in the world after the United States. The Association of Directors of Public Health has warned the government is moving too fast. Canada continues to record new COVID-19 cases in triple digits for the 6th day in a row. Provinces of Quebec and Ontario remains the epicenter of the virus, holding the majority of national death toll and caseload in the country. Quebec is the hardest hit province in Canada with 51,000 total confirmed cases and 4,600 deaths. Canada has recorded 91,000 COVID-19 infections and 48,000 recoveries across all provinces. Brazil has recorded 16,000 new COVID-19 infections, bringing the country's total confirmed cases to more than 500,000. The country now has a total of 29,000 COVID-19 deaths, 480 of which occurred in the last 24 hours. Brazil has the fourth highest death rate in the global pandemic after the United States, Britain and Italy. There is widespread criticism of President Jair Bolsonaro's alleged ways of downplaying the outbreak. Brazil's business capital, Sao Paulo, which has the highest number of COVID-19 deaths, has eased lockdown restrictions. The shopping centers and some stores will be permitted to open beginning today, with requirements for social distancing measures and the wearing of masks. Bars, restaurants, theaters and sports centers will remain closed. Up next, sports. Tonga rugby team stranded in New Zealand.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow the story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, Tongan rugby team members were part of many others trapped inside New Zealand, where the borders were shut to the outside world to contain the coronavirus pandemic. Reporter Owen Poland has the details on how the team is faring.
They travelled 2,000 kilometres from Tonga for the rugby trip of a lifetime, but their New Zealand tour was cancelled in March because of COVID-19 and they can't go home.
Mostly I miss my families and also my work, but hopefully the Tonga government open the border so we can come back.
Many of the 29 players have been sleeping on the floor of a South Auckland church and survive without any money on community donations.
It really helped us too. They have brought food for us. So we are surviving on that. And we are so grateful that we got stuck in New Zealand.
Tonga closed its borders in March to stop the spread of COVID-19 because, like most Pacific nations, public health systems couldn't cope with mass infections.
Healthcare systems is not the best, and often rural communities, small islands would have nobody that you could regard as a healthcare worker.
Over the past 200 years, thousands of Pacific Islanders have died from diseases like influenza, dysentery and smallpox, and the open border with New Zealand increases the risk.
This is not the first team of Tongan rugby players to be caught up in the middle of an epidemic. Only 7 months ago, another squad of Tongan players returned home from New Zealand and were identified as the source of a measles outbreak that infected more than 600 people.
Underlying health conditions also mean that the 300,000 Pacific Islanders who live in New Zealand face a greater risk of infection.
Up to half of them have diabetes, very high prevalence rates of heart disease, of asthma, of respiratory conditions.
And while their dream of playing rugby in New Zealand is over, the next tour could be to China.
We don't mind taking our team to China. if there is a chance. If sponsor can give us a chance to go to China, we don't mind going to China and play rugby there.
All they need now is a new sponsor and a flight home, maybe next month, to a COVID-free Tonga.
That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.